Good morning, good afternoon, good evening, depending on where you're joining us from. Colleagues, welcome to this weekly media briefing of the Africa Center for Disease Control and Prevention, an event that we have throughout the week to update you, the journalists, the population, through you, the journalists, on the happenings of public health emergencies on the continent. Initially, we were focused on COVID-19, the COVID-19 pandemic, but as we transition, and there are still other public health events happening on the continent. So our briefing nowadays covers all of the major public health events happening on the continent. So we want to say welcome. From last week, we are here to brief you again. We apologize for the few minutes delayed, trying to sort out the time difference considering the different time zones we are in right now, especially our principal. So our briefing covers most highlights on most of the public health events happening on the continent. That includes the COVID-19 pandemic, of course, the monkeypox, Ebola just announced in Uganda this week, and of course, other diseases or re-emerging diseases that are happening as outbreak, including natural disasters like flooding and others. So our acting director, Dr. Ahmed Okwel-Ouma, is here to provide this update today. So following the update as a regular procedure in our briefing, we will go into the question and answer period. So apart from the outbreak situation, the updates on the outbreak situation, the director will also briefly talk about the meetings and engagement that Africa CDC have had over the last 4 or 5 days at the ongoing UN General Assembly. And of course, then we will take your questions to the director. Colleagues, let's be informed that due to the longer scheduling that the director has, we are going to run our briefing today for 45 minutes. So a lot of the briefings will be briefed, and then we will share with you the briefing notes and, of course, the recording as usual so that you can have the detail for your reportage. So, ladies and gentlemen, without any further delay, let me welcome the director. But just before I do that, let me remind you of our medium to ask your questions. First, our WhatsApp number is active today, +251 94 550 2310. Let me read that again, +251 94 550 2310. Better still, you can use the Q&A section on the Zoom platform, or you can use the raise hand icon and put forth your questions, and they will be forwarded to the director for adequate response. Let me welcome you, Dr. Ouma, for the briefing. Thank you.
Thank you. Thank you, Nick. And good morning, afternoon, good evening to everyone, wherever you're joining us from. Today, as Nick says, we want to summarize some of the areas a bit so that we have adequate time for discussion, seeing that we have a short time, and also here in New York, we have quite a lot of early morning meetings to attend to. So as of today, the 22nd of September, let me start with the COVID situation on the continent. We have documented just over 12 million cases since the beginning of the pandemic, which accounts for 2% of the total cases reported globally. In terms of recoveries, we have seen just over 11.4 million, which is 95% of the total cases reported in Africa. And of the 255,733 deaths that we have witnessed, this results in a case fatality rate of 2.1% and accounts for 4.1% of the total number of deaths reported globally due to COVID-19. And it is important to note that the case fatality rate of 2.1% is still higher than the global average of 1.1%. And indeed, 41 of our countries are reporting their average for case fatality rate is higher than the 1.1%, which contributes to the continental average being higher than this global average. So although we have low numbers, we had, proportionately speaking, more deaths on the continent. In terms of variants of concern, to date, we are seeing exactly the same variants that we have reported from last week. And when we look at this EPI week 37, which runs between 12th and 18th of September, and we compare it with EPI week 36, we see that the number of new cases that we have documented during the week is 7,541. This is a 42% increase from the previous week. And therein lies a concern that the pandemic and the rate of infections and transmission on the continent is really a mixed picture. It is not a constant. So we are seeing a 42% increase when we look at EPI week 37 compared to EPI week 36. The highest are the eastern region with 38%, southern region with 28%, western 19%, central 8%, and northern 7% of the new cases. Now, when we look at deaths, during this EPI week 37, a total of 43 new deaths were reported, which again is a 43% increase from the previous week. When we do the 4-week analysis, comparing the past 4 EPI weeks, we see that the number of new cases overall showed a 1% decrease over the 4-week period. So when we stretch the analysis into many weeks, we see a much smaller change. When we look at this immediate past week, then we see that very significant change of over 40% in the number of new cases, as well as the number of new deaths. We need to keep that in mind going forward, because it does have implications in terms of preparedness and response for us here on the continent. Now, let's look at the number of tests. To date, just over 122.7 million COVID tests have been conducted on the continent. And during this past week, EPI week 37, we recorded 137,188 new tests, which is a 1% decrease from the previous week, 36. Now, for this week 37, the positivity rate is 5%, while the test per case ratio is 18. An improvement is that no member state is now reporting a test positivity rate that is higher than 12% during this particular week. To COVID-19 vaccination, 953 million doses of vaccines have been supplied to the continent. And of these, we have already consumed 685 million doses, which is 72% of what has been supplied. And we also note that to date, for fully vaccinated on the continent, we have 22.2%, while boosters have covered only 2.7% of the population. The countries, although figures are changing a bit, the countries that the 10 top countries on the continent remain the same, and we are working to get as many countries as possible to hit the 40% mark as we work towards our 70% full vaccination coverage in the coming weeks. During this past week, we also must note that Malawi has surpassed the 10% coverage rate for fully vaccinated and are currently standing at 12%, because we are always tracking those at the top, and then we are always tracking those who are at 10% and below. Sudan is at 9.9%, and we are working to get them to go above that within the shortest possible time. In terms of deliveries, we have had new deliveries, and to date, looking at the AVAT mechanism, we have delivered 79,200 new doses to Madagascar in the last week. And in total, as of this week, we have cumulatively delivered 81.4 million doses of Johnson & Johnson to 35 member states of the African Union. Of these 81 million doses, 56.2 is through the African Union mechanism. 17.9 is through our Saving Lives and Livelihoods program in partnership with MasterCard Foundation, and 7.3 was a US government donation. So we've handled through our AVAT mechanism 81.4 million doses. Now, let's now move to the concrete, more detailed update on the Saving Lives and Livelihoods program. As of today, 49 of our 55 member states have engaged with the program and are at different stages of processing and implementation. 34 of these have already completed their plans, and we are beginning to implement in the following 6 countries: Ethiopia, Kenya, Nigeria, Rwanda, Namibia, and Lesotho. So these 6 countries, there is active implementation, while at the same time, we have more countries that are joining in the coming weeks, including South Sudan, Sierra Leone, Togo, and Cape Verde. At the end of the month, we are going to have a big launch for the Southern Africa region in Lusaka with His Excellency, the President of Zambia. What we are seeing with the Saving Lives and Livelihoods program, where we are pushing for mass vaccination to try and get the numbers high, is that there is very significant changes within the country of the number of people who are getting vaccinated. And we are looking forward to this improving even further in the coming weeks. Now, let's shift a bit to the other public health emergency events on the continent. We are dealing with much more than what I'm sharing here, but we are looking at the key ones. And let's start with the good news, and that is Marburg viral disease in Ghana has been declared over, which is a testimony to what happens when different entities come together to support one public health intervention. We are very pleased that we were able to control this quickly and with minimal disruption to the socioeconomic activities in the country, and also kept the numbers the lowest possible with only that one case. So Marburg, as a public health event, is closed, but we continue very closely to follow with the government of Ghana surveillance, because it must have come from somewhere, and we want to be sure that nothing else challenges us. So today, I will share with you 9 other active public health events on the continent. And I will start with Ebola virus disease in Uganda, which was reported by the Ministry of Health the other day. Cumulatively to date, 8 cases, including 1 confirmed and 7 probable, have been documented. 1 case confirmed, 7 probable have been documented. 8 deaths have been reported, and of the 8 deaths, only 1 has been confirmed. The rest are probable. So a total of 10 suspected cases are currently under investigation, and 43 contacts have been listed and are currently being monitored so that we ensure that it does not spread beyond this particular area of Uganda. The Ministry of Health there has activated its Public Health Emergency Operations Center to coordinate the efforts within the country. And that comes with the whole structure of the Emergency Operations Center, including a task force, which is multi-sectoral in nature, and a rapid response locally. What we have done as Africa CDC is to mobilize ourselves. Our countermeasures are in place, awaiting that may be able to come. And usually in a situation like this, you want to be able to include in your planning all the immediate neighboring countries, because travel these days is very easy across Africa, indeed across the world. So we have our countermeasures stockpile ready for deployment at any time. Second is we've deployed experts to Uganda to support the Ministry of Health there in risk assessment, any capacity building that may be required, and also putting in place mechanisms for cross-border surveillance, as well as putting the system ready in case any other case may be found. So right now, it is those 43 contacts that are being closely monitored, and the 10 suspected cases that are under investigation, and those unfortunate 8 deaths, 1 being confirmed, the others are not yet confirmed, and we are working very closely with the Ministry of Health in Uganda. And this comes when we have not yet completed the COVID-19 pandemic. It shows you that in Africa, there is never a dull day for those of us who are within public health. Second event is flooding in South Sudan, in the Sudan. The Sudan government declared a state of emergency following persistent flooding in the country. And since June, when the flooding began, a total of just under 300,000 persons have been affected. And we have documented 129 deaths. So this is a very significant public health event on the continent. In addition, we have displacements. We have health facilities that have been destroyed or made inaccessible. We have water sources